colleagues from the Georgetown Institute of Reproductive Health and their FACT program in DC and also in Nepal online with us today. So just before we get started, a little bit about,
can everybody hear us?
A little bit about YouthPower Learning and also a little bit about the logistics for today. If you cannot hear me, please say something in the chat box. And actually, if you can hear me at this point, please let me know.
Yeah, we can hear.
Okay, great. We will have a Q&A session at the end of the presentation, so please feel free as your questions come up to put them into the chat box. We will be monitoring it and making sure to get to those questions and making sure that our panelists get those questions. If we run out of time and we don't get to all of them, then we will make sure to respond in writing to those that we didn't manage to answer online today. So again, as your questions come up, please go ahead and just put them into the chat box and let us know if you can't hear or if we need to speak more slowly or you need us to repeat anything. So we're bringing this presentation to you today through YouthPower Learning and through the Gender and Positive Youth Development Community of Practice of YouthPower Learning. YouthPower Learning is a multi-stakeholder partnership designed to advance positive youth development in low and middle income countries and through development programs. The Gender and Positive Youth Development Community of Practice has myself, Chelsea Ricker, as a co-champion, and also my colleague Chasina Kapungu at the International Center for Research on Women. We in particular like to look at the cross-cutting issue of gender, and we have a very holistic definition of gender in positive youth development and look at the intersections of how gender, youth, and other forms of marginalization affect people's access to development programs, which is very much the spirit in which we're bringing you this presentation today. So I am going to stop speaking soon. You can see me on the far right there. And hand over to my colleagues at IRH. We have with us today Naramaya Limbu from IRH in Nepal. She is the Senior Program Advisor for the FACT project. Prior to working at IRH, she worked with USAID in Nepal as the team leader for family health. Naramaya has extensive experience in designing, managing, and evaluating projects related to family planning and reproductive health, adolescence, maternal, and child health. We also have with us today Sandra Chipanta from IRH here in DC. Sandra has over 6 years of experience in management and implementation of international development interventions in West Africa and Asia. At IRH, Sandra manages the FACT project in Nepal and also a faith-based intervention in Nigeria focused on masculinities, faith, and peace. Sandra has expertise in maternal newborn child health, HIV/AIDS, and sexual and reproductive health. We've also got with us today Dr. Dominic Shattuck. Dominic has over 20 years of development experience focused on rigorous public health research, implementation science approaches, and behavior change interventions that increase access to health services, education, and economic opportunity. He also has vast experience leading social behavioral research projects around the world in areas related to HIV, gender, and family planning. So it should be a really exciting program today, and I am thrilled to be able to hand over to Naramaya to tell us a little bit more about the FACT project in Nepal.
Thank you, Chelsea. Let me start with the background, and before that, let me highlight a little bit about family planning context of Nepal. 26% of married women currently use family planning, while 39% of married women have an unmet need for family planning. Additionally, married women living in rural areas and marginalized community experience higher unmet need for family planning. For example, among the marginalized communities, Muslim has highest unmet needs, that's 37%, Dalit 31%, Janjati 28%. Literacy impaired on access to family planning information in addition to cultural and geographic diversity and the frequent migration of male partners, particularly internationally.
Jeremiah, can you speak a little bit more closely to your microphone, please? People can't quite hear you.
Okay, shall I repeat?
Okay.
Okay, so let me little bit talk about the family planning context of Nepal. 26% of married women currently use family planning, while 39% of women have unmet need for family planning. Additionally, married women living in rural areas and marginalized communities experience higher unmet need for family planning. Among the marginalized communities, Muslim has highest unmet need, that's 37%, and Dalit 31%, and Janjati 28%. And literacy impaired on access of family planning information in addition to cultural and geographic diversity and the frequent migration of male partners internationally. Finally, existing taboos around family planning, fertility impaired on the conversation about reproductive health and puberty. Many find it uncomfortable to discuss fertility and reproductive health with a partner or their peers. Sometimes this conversation occurs but happens too late, and frequently the conversation is saturated with the misconception. The next slide. The Fertility Awareness for Community Transformation FACT project started where a lot of family planning programs start seeking to reduce unmet need. Many women want to avoid pregnancy but are not using modern family planning methods. Through the FACT project, we seek to increase family planning use by improving fertility awareness. And we define fertility awareness as actionable information about female and male fertility throughout the life course and an understanding of how this knowledge applies to one's own circumstances and needs. We hypothesize that increasing fertility awareness will lead to an increase in family planning use. You can see from this slide the FACT was implemented in 5 districts of Nepal. One is mountain district, 2 are hill district, and 2 are Tarai districts, where we tested our hypothesis. Next slide, please. So, our key beneficiaries included youth, both men and married and unmarried, and postnatal women in addition to couples who would like to delay or space birth. We focus on youth aged 15 to 25 years and postpartum women in marginalized communities. These communities are the mandate of the government of Nepal, which identify them as marginalized groups or hard to reach regarding reproductive health and services. Next slide. To inform the design of the intervention, the FACT project invested heavily in participatory formative research in April 2015. Formative research was important to design the intervention because it provided an understanding in our communities regarding fertility, awareness, family planning use, menstruation and menstrual hygiene, and cultural belief and practices related to the family planning, acquisition of family planning knowledge, communication related to family planning among women and men, and barriers and facilitators of family planning use among men and women. Next slide, please. So, formative research activities were implemented in April 2015, right after a massive earthquake, which affected one of our districts heavily. The result of the formative research confirmed the major drivers of non-use of family planning methods from the literature review we did. Next, please. Next slide. So let me little bit talk about the findings and that project conducted to look at the barriers of family planning use. That study revealed that some of the key barriers, like for example, limited knowledge of fertility and family planning methods, particularly how family planning method works when fertility returns, that were the lacking, and there was a very low level of knowledge about the long-acting methods, particularly IUCD and implant. And the other one was religious and cultural factors, including social norms around a son preference and giving birth immediate after marriage. And another one was husband disapproval. Husband was the key decision making to decide for the family planning use. And another one was fear of side effects and misconceptions around the family planning methods and structural barriers such as long distance. They have to walk to reach to the health facilities. It was a quite long distance and limited method mix. Some of the methods were not available at the health facility and the lack of female providers, etc. These were identified as the factors influencing unmet need for family planning and pregnancy, early pregnancy especially. Through the formative research, we also asked how participants would prefer receiving fertility and family planning information in their communities. And for example, such as radio, group session, training, and games were mentioned. There was a lot of emphasis on games as participants suggested to the fact that games will help communities and have this conversation in a fun and non-threatening way. Training, even though mentioned, were not ranked as high as games. Next, please. Using the human-centered design approach, the FACT project led a series of solution development workshops in November 2015 to share formative research results, validate the results in our communities, and work with communities to design an intervention relevant to their specific context. The workshop included participatory exercises such as personas, walking in their shoes, team building, and social networking. That's all. Now, I would like to hand over to Sandra, I think. Chelsea, sorry. Chelsea.
Great. Thank you very much, Naramaya. So I'd like to talk a little bit about how we went about developing the games that we ended up using for the Pragati intervention based off of the investments that IRH made into their formative research and the solution design workshops. So there are a few things that we knew. And this is why we decided on games. We knew that we were trying to reach remote communities with varying levels of literacy and speaking multiple local languages. We knew that we needed something that worked easily in Nepali culture and made sense to the female community health volunteers who would be tasked with rolling out these games, and that simplified some of the technical and medical language around fertility and family planning and made it more accessible to community members. But we also wanted something that was memorable and easy to learn, so games. Games aren't necessarily universal, so through this formative research process, through the solution design process, and then through the game development process, we went back multiple times to learn how people, and particularly young women in Nepal, play games, what types of games they play, and how we could use those games that were all very familiar to them to distribute the information that we want to spread. So the banner headline here, the question is, are games universal? And the answers are no, yes, and maybe. we met with local youth and youth-serving organizations. We met with community youth groups. We met with healthy mothers groups in the communities identified by the FACT projects, and we worked with female community health volunteers. Also, IRH had already been using a few games, including a modified version of musical chairs or London Bridge that teaches the menstrual cycle, and a seed game that explains gender selection and sex selection in utero. So we went to Nepal, and we basically just said, teach us your games, teach us what you learn, teach us what you use, teach us how you use them. We learned a few things. One thing that I don't think should be surprising is that women and girls generally don't have as much access to play time. They have fewer opportunities to play, and many girls in particular stop playing games when they reach adolescence and take on more responsibilities in their families. And so we had to, especially with women, go back to their childhood to find games that were familiar to them. There are also gendered rules about who can play what kinds of games. The one that kept coming up most prominently was that cards of any kind are associated with gambling, that playing cards are associated with gambling, which is both illegal and the province of men, and therefore we heard over and over again from the female community health volunteers and the healthy mothers groups that they couldn't be seen with things that looked like playing cards, but that women preferred games that involved more communal sort of role-playing, singing, dancing, group activities. We also needed to unpack a little bit further some of the power hierarchies and social taboos that are still present in game playing in terms of who can play what with whom. If you're going to have a mixed gender group, or if you're going to have a group that includes female community health volunteers with community members with local health workers, there are power hierarchies invested in all of those relationships that you need to unpack in order to get people to play games together. But we'll end on the positive. Women and girls want to play games. Everybody likes playing games. And we heard over and over again that that women, and particularly adolescent women, would be more likely to attend health talks and healthy mothers groups if there were games they could play there, if there was an opportunity for play. We also learned that some games are universal. For example, snakes and ladders or chutes and ladders seems to exist in many communities. There's a version of hot potato, the game where you throw something from someone to someone else in many cultures, and Nepali girls play a version of hopscotch that you'll see later we ended up adapting to talk about life planning. There's also a game that I personally know as Red Rover, where you have two lines where people run across the field to each other. That one didn't seem as adaptable to family planning, although we did try. There are other games that are easy enough to learn that they feel universal if they're simple enough. So things like puzzles or matching games were very easy for people to pick up. And then again, different types of games work better for different audiences because of, that the power hierarchies and understanding the relationships. And so, you need a facilitator who's capable of understanding how those work and choosing the right game for the occasion. So what was the actual game design process? Learn, test, refine, repeat, basically. So we learned games, we tried a couple of games with audiences to see if they would work, and we tested them over and over again, including through a proof of concept phase, where IRH put a lot of effort into collecting data through direct observations, interviews, focus groups, and staff debrief meetings, to think through not just the game itself, but the design of the training, the implementation, and the sort of discussion pieces that were included, and the engagement there. We found that games needed to be short. they needed to be short and they needed to be standalone, right? You need to be able to pick up a game and use it on its own and not necessarily with a bunch of other content. You needed to be able to keep track of all of the information and the discussion questions in a way that made sense for the playing of the game. But also that the games were attracting larger crowds, and so they needed to be designed to be managed with a larger crowd or to have adaptations for if you are expecting 10 people and 30 show up because they hear there's a game, you don't want to turn people away. We also needed to consider some of the resources and logistics available. Female community health volunteers in Nepal, particularly in rural areas, are frequently walking tens of kilometers a day to reach these communities. They can't be carrying a lot of heavy materials with them. So they need to be easy to learn, they need to be easy to carry, and if you do need additional materials, they need to be locally accessible, they need to be locally resourced. And then finally, as in all cases, you need to make sure that you have the government on board. So we met with the government and specifically with the Nepal Health Education Information Communication Committee and their Behavior Change Communication subgroup multiple times to talk through the content. The technical content on family planning was all adapted from the Nepal National Curriculum for Service Providers. And then we also worked with a local artist when we needed additional icons and infographics. We worked with a local artist to develop images that were culturally appropriate and relevant. So the final product was 9 games. We had developed 10, but during the proof of concept phase, one just really wasn't working for us, and so we ended up with 9. They're loosely divided into 3 categories. There's fertility awareness games, including, as I said, adaptations of the menstrual cycle game and what we're calling the son-daughter game, which talks about how sex selection is made in utero and the difference between an XY and an XX chromosome. Those were adapted from previous tools that IRH had used in Nepal and elsewhere. We had family planning games. We had a side effect puzzle where, again, we worked with a local artist to develop images of common side effects and also commonly assumed side effects, common myths about side effects. And then if you pulled the fake side effects, the myths out of them, then the actual side effects, if you flipped them over, would form an image of a healthy Nepali family. So it was a way of kind of determining what's real and what's not. We had a match where people can match a method to where it's a version of a game that I know is memory. So you flip a card over and then you find the matching card. And that provides opportunities to talk a little bit about what the methods are, what's available, match them to their side, and then we adapted that as well to match the methods to their side effects. And then we had the final category, which I'll do in a little bit less detail, is around social and community norm games. So like I said, we adapted a version of hopscotch, which was a game that Nepali girls were used to playing, to talk about life planning and at what age you might want to get married and have kids and finish your education, not necessarily in that order. We had an agree-disagree game adapted from common role-playing ideas where people would have a chance to debate issues, a different role-play game where people would have a chance to act out conversations about family planning with other members of their community, and like I said, a version of hot potato, which is really infinitely adaptable and can be used for any topic. So that's kind of where my piece of it ends. Was in the development of the game. So I'm going to hand over to Sandra to talk about the investments that IRH made in rolling them out.
Yes, thank you, Chelsea, and thank you, Maya, for setting the stage for us. So once we design the games through the proof of concept and finalize them through the proof of concept phase, our team worked on a plan for rolling out implementation activities. So we designed 2 days orientation for the promoters. So basically the female community health volunteers, the health mother group champions, and the male champions. And also we included health facility staff, and then move on to one-day orientation once we were clear that the promoters understood the steps of the games and had a good grasp on how to play those games. So during the orientations, participants were taught to play the games and also on how to facilitate the discussion questions at the end of each of the games, and also how to fill out the monitoring and evaluation forms. So given the varied levels of literacy for our promoters, as we were working with them a little bit more, we realized that some of them were really good with reading and writing in English, and then some of them didn't have the same literacy level. So we oriented. So what we did was we oriented the promoters on the first 3 games, which were the Method Cycle game, the Sun Daughter game, and then the Method Match game. And then once we got a good grasp on some of those on those 3 games, we introduced the remaining 6 games monthly until they mastered all the games. So the reason why we started with 3 games is that all the games follow the same structure. So basically you have how you play the games, you have the instructions of the games, and then at the end you have reflection questions at the end of each game. So by playing different games, the promoters kind of understood that each game followed the same format, and for them to understand that format is important, and then focus on understanding the content of the game. So this phasing approach enabled us to rapidly identify challenges such as not playing the entire game due to lack of time, not correctly facilitating the discussion and reflection questions, managing large crowds, which was also an issue that came out with the proof of concept phase, and then the inability to find enough men to play with. So through that, we figure out how to develop some solutions, such as coaching promoters, the ones who are struggling a little bit with facilitating the games. And we also identify additional men's groups to play the games with. Through the phasing approach as well, we built in a tracking and M&E into the implementation rollout, and that helped us ensure that the M&E tools were simple enough to be filled out completely by promoters, and also to revise some of the indicators that we're collecting data on to just make sure that we are getting the right information and able to do the right data analysis. So then after phase 1, we stopped halfway through for a need implementation review to learn from that particular phase. And we are calling it a need implementation review and not a midterm evaluation, because even though we initially planned for a midterm evaluation, we didn't have enough time to actually go through an institutional review board and do a complete evaluation. So we decided to do a rapid assessment of the intervention slide to discuss implementation and use data for decision making, to modify implementation strategies based on lessons learned from phase 1, to modify the M&E system as well, and then to discuss scale up both at the community level and at the national level. So through the mid-implementation review, we analyzed the findings using a simplified strengths, weaknesses, opportunities, and threats SWOT approach. So with these findings, we established a coaching system for game implementers in the community, where we actually identified strong promoters and paired them with weak promoters so that they could walk the weak promoters through gameplay. Our team also conducted coaching visits, so through observations, so they were monitoring and they were watching the game implementers, the promoters, lead the games and provide constructive feedback right after gameplay for the promoters, for the weak promoters. We held quarterly joint monitoring update meetings with local officials, so we are calling those data sharing, where we show, we distill the information and then present to local stakeholders about basically how the game was, how the implementation was going, where we are, what help we need to increase community engagement and buy-in. We held joint monitoring visits with government representatives as well to increase buy-in and facilitate scale-up. And we increased reach in communities by diffusing games through other platforms and organizations, such as schools and women's cooperative clubs. So we were refining the game materials as we were going through, especially after phase 2. And we were, at this phase, we were also trying to finalize the material. So we developed a Pragati manual, and we developed game materials, which include game instruction cards, chapter cards, and game playing cards. And then we also have resource materials, so our M&E materials, our M&E forms, and our M&E tools. So, so the game instruction cards were simplified to facilitate use by promoters, in addition to the M&E tools. For example, because we had low literate promoters, we had to include pictures on the M&E tool so that instead of having to read what the game was, the promoter can just look at the icon and know what game it is that we are referring to, and then include the right information, either ticking, or also what we did was we paired some of them Health Matters group champions who are literate with the with promoters to help them fill out the forms. During phase 2 as well, we also noticed that some promoters were adding some tweaks to the games. For example, for the message circle game, they were introducing songs about the messages, so they'll when they are playing the game, they'll just go around and sing songs around those messages. So the Pragati manual includes the game instructions as we primarily designed them, and also adaptation to some of the games based on what we learned from the promoters playing the games. So what did we achieve? We realized that among participants aged 15 to 25, consistently 81 to 86% of women were reached by promoters, and that games were integrated into processes and interest was high. And this is compared to 15 to 90% of men who were reached by the intervention. Now, we reached a lower number of men than we reached women, because one of the things that we were struggling through and that we were cognizant of at the beginning of the intervention was the high migration rates, both internally and internationally in Nepal. So it was difficult to reach out to men and also through men's group. And when we reached out to men, most of the time we were reaching out to men who were above 25 years old, so age 26 and above. We also realized that the game transcended their original platforms. So the original platform were to implement the games through health mothers groups and female community health volunteers and male champions. But then as we were playing the games, other groups like youth groups and adolescent groups and poverty alleviation groups were interested in playing the games. And also this was a response to, as we were implementing the games, there were a lot of structure change at the MOH, at the Ministry of Health level, and also there was a blockade in some of a gas blockade in some of the communities that we were implementing in. So instead of activities just hoping for solutions to be found, we decided to continue playing the games, but to reach out to other groups that were present in the communities that we were working in. So right now, I will turn it off to Dominic to talk to us about scale-up and also increasing the reach of Pragati.
Great, thank you, Sandra. We're really excited and appreciate YouthPower having us this morning. And I see on the participant list several of our colleagues from Save the Children who were really instrumental in this work as well. You know, the expansion of the games is actually very amazing. We learned quickly that the games, you can go back to the headline for a second, but we learned quickly that the games contain relevant content. They're also inexpensive and easy to transfer. And as Sandra was talking about, they appeal to a wide range of beneficiaries. So even though we started with our adolescent, female adolescents who may be in need and unmet need of family planning is high, we see that these games are relevant to other people in the community. And that came through in some of the qualitative documentation and papers we'll be writing shortly. So, yeah, if you go to the next slide, please. Oops. One up? Yeah, right there. Thanks. So as you can see in this slide, we established the capacity to play games in both partner organizations and within local government bodies. And thanks in large part, to our SAVE colleagues and in particular our colleague Nari, several multi-sectoral programs in Nepal have integrated multiple games into their programming. The number of games they integrate depends on their focus, the amount of capacity they have in their projects, and what kind of fits well. But because we touch upon a number of different topics in the 9 games, different programs have integrated different games. And for example, some of the programs in Nepal that are using these games include FPAN-SIFPO, FPAN-SIFPO 2, I should be more specific, the Suhara Nutrition Project, Contraceptive Retail Sales, which is a social marketing project in Nepal, nationwide, Save the Children Sponsorship Program, new wards, like new government areas, the ward level, which is the smallest level of Nepali government structure. I've also used some of the games and integrated the games into their activities, as well as USAID-sponsored WASH programs. We feel like some of these activities around the menstrual cycle and understanding the menstrual cycle are really critical for young adolescents to understand their bodies and understand, if it's a boy, even understanding some of the dynamics that are happening in girls' bodies to reduce some of the stigma. So thanks to those efforts, our team, and the interest in the projects, we've expanded the gameplay in from 5 districts to more than 56 districts of Nepal. So you can go to the next slide, please. So as we're scaling up, we also began to explore what it would mean to go digital. So what would it mean? How do we reach more people? The physical games are great, and they do a nice job in reaching people across the country, but they have their own limitations. So let's look at other ways to kind of get this word out and get this information out accurately. So if you go to the next slide, please. Like in many countries where we work, access to mobile phones and the internet is becoming universal. So we wanted to explore the acceptability of mobile games. IRH has a significant history working on mobile phone technologies for health. Eventually, we hope to develop a platform that will grow and embrace a variety of topics, building out from these original Pragati games. But to do this, we were fortunate to partner with GRID, or Gaming Revolution for Inspiring Development, to start with an initial set of 4 games. If you go to the next slide, please. Adding this platform diversifies our ability to engage learners in new ways. Over time, we see the marriage between those physical games of Pragati and the digital Nari Siler games through branding. We also see this as a platform that will evolve. The Nari Siler games are now available for free download on Android phones, and they provide us with an overview of 3 of the Pragati games plus 1 game on menstrual hygiene management that was created by GRID. If you go to the next slide. Again, you've got to put things into context, as was mentioned by Chelsea and Sandra and Nari earlier. And so to tell the story of the mobile on the mobile platform, we're using different characters. Once you're outside of Kathmandu, it's pretty common to see goats in Nepal. And so we chose to use to establish Bakari, a female goat, the family goat, as a facilitator of gameplay in our mobile games, while her nemesis, the Yeti, tries to spread myths and push players to make bad decisions. Again, you can see how this kind of feeds back to the Pragati games earlier on and some of the things that Chelsea was talking about. If you go to the next slide. We also set the games on the backdrop of a multi-generational family. So like most places, culture and family influence decisions. And the games provide an example of challenging conversations between elders and adolescents. They also provide accurate information about reproductive health decisions. And so it's up to the characters, up to the players to help the characters make good decisions and avoid unnecessary challenges in their life. So if you go to the second to last slide, I think. Right now, Nari Siler consists of 4 games that hit upon fertility awareness, menstrual hygiene management, spacing, and family planning side effects, and sex determination, also known as some preference. Again, they're available for free download on the Android phones, and our team is actively working to secure funding to expand the number of games and contextualize the existing games for new countries. We go to the last slide. So before we start some questions and answers to the presentation today, to give a little summary, we have a few conclusions. And first, community games offer a viable solution for addressing fertility awareness and social norms with youth, marginalized communities, and low literacy groups. Second, games are adaptable, provided they're designed in an adaptable way. They can be easily integrated into community-level programs and have the potential for digital expansion. Third, games offer opportunity to integrate family planning into programs addressing other topics. For example, the Pragati games were integrated. The Pragati game integration is mutually beneficial for programs that seek to address social norms related to reproductive health issues such as gender-based violence, early marriage, menstrual hygiene management, or some preference. And last, mobile games offer a new and innovative way to reach youth and provide accurate information in a safe environment. And they also provide the potential to effectively link adolescents to services. So thank you very much for tuning in today. This has been a really nice opportunity for us to share the games and get the materials out, and to really interested in some feedback on this. Thank you.
Great. Thanks so much, Dominic, Sandra, and Naramaya. And I'm going to go ahead and start pushing some of the questions that we already have in the chat box out to you, while encouraging people to continue to add their questions. We've got a little over a half hour here to have a discussion, so please feel free to ask anything. So I'm going to start with, there are a couple of questions about the existing platforms that we used in Nepal, and also some of the issues that we ran into around literacy and language barriers as we implemented around Nepal. So I'm going to ask maybe Naramaya to start with talking a little bit about the existing platforms and the Nepali health context, and then we'll go from there. So Naramaya, take it away.
Norma, are you there?
All right. Well, maybe Sandra, you can get started while we figure out how to get Naramaya back to where we can hear her.
Yes, not a problem, and apologies for that. She's driving it all the way from Nepal, so we knew that her internet might be going in and out. So in terms of using existing platforms, so what we mean by using existing platforms is basically using a platform that is already existing in Nepal in terms of health platforms. So when we started the intervention, we were also thinking about sustainability. So basically, we were thinking, we started with the end in mind, and we wanted to have an intervention that could be easily scaled up within the country as well. So we identified female health volunteers, which provide family planning information and general reproductive health information to communities, and they are based at the community level. And they work with health mothers groups. So they lead these health mothers groups where mothers come together to discuss basically any issues related to their babies, and also if they have any questions about family planning. And the female community health volunteers provide some family planning methods at the community level, so condoms and pills. So we identify them as the platform to use to carry out this information, since they've already been providing some reproductive health services at the community level. And the community members were already familiar with the female community health volunteers. They know them by name some of the time. The female community health volunteers are very much so integrated into the community. So using an existing platform already also helped us kind of not have to now introduce new kind of health providers at the community level and do the community engagement and then the buy-in that to establish them at the community level. So once they're already established, we just make sure to orient them on the games and to not add too much onto to their load, but also to ensure that they can play these games correctly at the community level. I don't know if that answers the question, but if you have any follow-up questions, bring it up.
Great. Thanks, Sandra. Dominic, I'm going to ask if you have anything to add to that, and I'm also going to ask you to talk a little bit about some of the results that we saw in terms of the uptake in use, and whether there was any sort of add-on effects of people learning about side effects or fearing side effects they learned about through the game.
Yeah, so I don't have anything to add to Sandra's response. I think the big thing about the side effects and what we're seeing from individuals in terms of the data are a couple of things. So qualitatively, we see a lot of information around people just being able to talk about and clarify accurate and inaccurate information about family planning. I feel like that's a key thing in two ways. One is because they have the right information, and two, because they're actually willing to have a conversation. Time and time again, in both the qualitative data and some of the quantitative data, we see this dynamic of discussion come out. And we all know. I mean, it's not. You don't have to be from Nepal to be in a situation where it's difficult to talk about reproductive health issues. This is something that is universal, and I feel like when people have the right language, they have the right information, and if they've learned it in a way that's comfortable and presented in a non-threatening way, that provides them with opportunities to kind of process it and share it. The other thing is that we didn't really talk a lot today about the role of critical reflection in the game. And critical reflection is kind of this component of the games where we asked a few specific questions about, in your community, how would you find this, where would this information be relevant, who would it be relevant to? You need to take, this goes back, this is not a new concept, it's not something that we've created, it's been around for a long time, and having worked in men's reproductive health programming for quite a while, this is something that you find in the very beginning of those projects, where time and the opportunity for people to process the information that they've learned is a component to the games and to the intervention. And I feel like asking people questions where they have to apply the knowledge and see the benefit of the knowledge on their own really kind of help this project move forward and to the acceptability of the games and kind of the movement of the games to other places. I feel like it also, one of the things about using language that you're learning is you have to be able to contextualize it. And if you don't have those critical reflection questions, it's just like learning anything. If you learn a little chunk of history and you're not kind of putting it into context, it's not relevant to you. You may be able to cite the dates and the actions, but the real relevance of that history doesn't really help you. So asking those questions, those critical reflection questions, are really important in kind of retention, relevance, and those things. But yeah, we're seeing conversations, critical reflection are really key elements to this in terms of the, what drove some of the change in attitudes. And quantitatively, we see a couple of things. So fertility awareness scores increase significantly in the intervention communities. We also see things that, norms around family planning in the intervention communities were very high. So when we think about those changes, intervention wasn't implemented for a long time, and the data in terms of the number of married women who would be converting from unmet need to actual met need was minimal, but we did see a lot of attitudinal changes, and we did see some changes in significant changes in uptake when you parse out some of the married women with unmet need over time. So, yeah, I hope that answers the question.
Yep. Thanks so much, Dominic. I'm gonna take a little bit of moderator's privilege to also add in a couple of things around the use of the game. So, to the question about whether they need to be rolled out by organizational partners or whether they can be used by community members as a standalone, I think it's important to kind of talk about the difference between the methodology and the content of the game. So, and this will also get a little bit to the question around low literacy. So we tried to make the content kind of as straightforward and as graphically represented as possible. So for example, on the side effects, we included a bit of an answer key. So there would be a picture of a side effect like headaches, and then we would include the same images that the Nepali government uses as images of family planning methods in miniature on those cards, right? So if you had headaches, then say you would have a picture of pills and a picture of an IUD and a picture of injectables at the bottom, so that you could eat. The content should be fairly accessible, even if you haven't received extensive training. As long as you know what you're looking for on the card, you should be able to find the content. And part of the reason that we did that was that piece around the existing platforms in Nepal, which is where these were really designed to be cascaded out into communities through the female community health volunteers and through champions within those healthy mothers groups who could easily kind of pick them up and learn them and continue to play them. And so for the most part, they can be played in communities. If you've played it once, you can pick it up and play it again. We didn't try to make them complicated or tricky in any way. We really just sort of thought through what's the easiest and simplest way to get this information across. So I'm then going to turn back to Sandra maybe to talk a little bit about there was a question around impacts that you're seeing from them, which I think Dominic already answered. But then there's also a question about whether whether you're documenting the lessons learned from the implementation strategies. So maybe we can go to that next.
Yes, so we documented the lessons learned from the strategy in the manual. So when you go at the end of the presentation, Chelsea will point everyone to our website where you can get more information. But we created a manual, and the manual documented basically what our implementation strategies, and also how we switch strategies from phase 1 to phase 2 as well. So you can find a lot of that information in the manual. We also have a proof of concept report that is on our website on irish.org, and that also documented basically how we conducted the proof of concept, how we learned from the proof of concept phase, and adaptations that we made to the games. So both the proof of concept report and the manual should provide enough information about how we switch strategies, what the lessons learned were, and how we supported our promoters during game playing. Chelsea, there was also one question about if we ever ran into issues of low literacy when implementing some of the games. And I just wanted to touch on that really quickly. That yes, that was a big challenge that we had to deal with throughout the entire implementation. So once we decided on existing platform, and especially the female community health volunteers, and started to understand a little bit more about what they did, and also understanding a little bit more about their skills, we realized quickly that there were a lot of them that are strong. So you have a lot across the skills spectrum. So you have some of them that are strong and some of them that are really weak, and low literacy was a key issue. So some of the things that we did was we tweaked the games to include a lot more pictures. We also increased more of the training of those weak and low literate female community health volunteers. And we included some coaching activities into the implementation. So we were observing, we identified some of those low literate female community health volunteers and followed them, and also provided some coaching, but also identify strong female community volunteers to pair up with some of the low literate ones. And I have to also say that at some point, because we couldn't follow them up, at least those low literate one, enough for them to play the game correctly. So we came also to a point where we had to phase some of them out of the intervention, knowing that they wouldn't be able to play the games at the community level. So because we're also working in 5 districts, some of the levels were different across districts. So we just made sure that we were cognizant of who those low literate female community health volunteers were, and tried to troubleshoot a few times, and then figure out if that's not going to work, then just phase them out of the intervention. And that is also why we reached out to other platforms when the female community health volunteer couldn't really implement the games. So we wanted the games to be out in the community, but also at the same time didn't want to compromise too much on the quality of the information that was getting out to the community.
Thanks so much, Sandra. I think I see Narimaya back online. So Narimaya, if you can, I'd like to ask you to talk a little bit about the impact you're seeing on the beneficiaries and the people playing the games in Nepal. Hi.
Hello, do you hear me?
Yes, I hear you loud and clear.
Yes.
Hello. So, hi.
Hi, Nar.
Okay. So, there was a lot of lessons learned from the implementing Pragati games. We call the state of games Pragati. Hi. We name it Pragati. So, I may be talking about Pragati. That means 9 state of games. There are lots of learning. Like, for example, like when we implemented at the earlier stage, there was little bit discussion points were at the end of the reflective questions and discussion points at the end of the game. But what we found was the participants were hurried to go back to their homes. So what we did was, while we refined the game, we moved the discussion reflection questions in between the game, before starting, in between the game and starting of the game, so that they will internalize what they are learning from the game. So that was one of the lessons, because the community people won't wait for like 30 or 1 hour. The game actually took around 20 to 30 minutes and sometimes 45 minutes, depending upon who the community level promoter is facilitating. So that way we changed, and later on we simplified the steps as well, because some of the steps were so hard for the facilitator to remember, and simplify the words, the common words they understand. That way we have refined it, and now it's a final, we have the final version which can be easily adaptable and scalable in the community level. And the language was little bit a barrier in some of the places, but the facilitators, the community promoters, they could speak and speak in their own language, so that was not a problem later on.
Thank you so much, Naramaya. Dominic, I'm going to come back to you. We had a question about the uptake and use of the digital games and if there's a specific implementation strategy for the digital games.
Yeah, so we have, thanks for being interested. We think it's really exciting stuff, and I think without the Fertility games, it couldn't have happened. You know, I mean, this is building off of games that were tested, and even though the games they don't play the same, the content of the material is really what's key here. But uptake is decent given that we've only just started to market the games in Nepal. So we have taken an approach that is a strictly digital marketing approach of the games that is focused on a variety of different outlets such as Facebook, and we have a Facebook page, we have an English and Nepali, we have a Instagram page in English and Nepali. We also are using social media like TikTok, where we are doing competition around a short music video that we put together, and it's been pushed out, and some of the users of TikTok are building their own videos. We also are doing some Google ads, and all of this is being launched in full this coming week. Influencer videos, instructional game videos that are being developed as well. So those things will be coming out. Most of the materials in terms of the videos that will be in Nepali, local relevant context there. And what we're seeing even before we have about 400 downloads, 350 downloads as of this morning after the last week or so, even though we haven't really marketed the games in full. So today we built in a new update we'll go out today, and then the marketing materials will really start to be pushed in the fall. We'll see how that turns out. So it's happening, and we feel this is a great learning project in terms of not only understanding what these video games are, these mobile games I should say are, how their acceptability and how people, if they like them. We realize this is a pilot. They're going to have to be changed, and they're going to have to be streamlined quite a bit over time. But just kind of understanding the reach, how to reach people, how to get the downloads, how to get the different metrics that you use on the internet to measure reach and how people are perceiving the games over time. So it's an exploratory activity. We were lucky enough to have a no-cost extension that we've done really on a shoestring budget, and we're ready to kind of learn from it and expand it.
And are you able, Dominic, to use the mobile and digital platforms as a data gathering tool as well?
Yeah, so there's, for people who are less familiar with the mobile data that's available, so there's a high level of analytics that you're able to capture in terms of downloads and uninstalls and time on pages and number of gameplays. But we've also embedded several different surveys and quick questions, some learning questions around, for example, one of the games is focused on building off of our puzzle game and focusing on myths and misconceptions. And there are some questions embedded in there. And understanding when people are able to get them right the first time and the second time and that kind of thing, that type of thing, and seeing their learning over time as they play the games longer. So yeah, we are capturing a few different dynamics, a little bit of demographics, non-intrusive demographics, trying to understand who's playing the games, trying to get a little bit of behavioral or knowledge information, and then we ask a few behavioral questions. But we kept it very, very streamlined, very uninvasive for this pilot activity. Because all of us know that you only want to answer so many of those questions every time you open an app. So, yeah, trying to take that philosophy forward.
Okay. So, and then Narmai has actually already started to answer, but we had a question about transferring these games to other countries. I understand they've already been adapted to India and I believe also Bangladesh. So if Narmai or Sandra would like to add a little bit more detail about that.
Yeah, here in India, in fact, they have adopted, started with the son-daughter game, they said to me. I think it's in Uttar Pradesh of India. And Bangladesh, one of the ladies, she was really interested while we met in the SBCC conference in Bali. She told me to forward the game instruction, guidelines and manual. I have forwarded, but I'm not sure whether she started the games or not. She was especially interested in introducing menstrual cycle game.
Great. Sandra, any other?
Sandra, do you have any other?
No, I just wanted to add that, we've been in communication with multiple organizations that were also identified at the International Family Planning Conference in Kigali last year, and where we presented the games, and quite a few were interested in the games. So at this point, we've just been providing technical assistance to interested organizations about what the games are, where people can go and find information. And then choose the games that are relevant to their programs. So we are willing, to work with organizations that way and have all the materials and the how-to videos out there to help people identify the best games applicable for them.
Great. Thanks. And we've got one more question about disaggregated data, whether you've been able to disaggregate the results and if you're seeing any significant differences among adolescents or among married and unmarried. So I think Sandra, maybe, or Dominic.
Dominic, do you want to go?
Our sample size was driven by experience in the field as it the access to men. And, in Nepal, almost 50% of the male population between the ages of 18 and 39 is outside of the country working nationally, migrating to work. Places like Indonesia, China, North Korea, the Middle East. And so because of this, you have we learned in the formative research, it was hard to identify men and get them into the study. Also, because they're physically and this dynamic is significant. Our entire sample was adolescent. They were 15 to 24, 15 to 25, 24. So the thing is that our results that you'll see in the brief on our webpage is reflective of that. Our gender differences weren't necessarily significant. You don't see big differences in terms of the attitudes and behaviors, mostly because those men who are there, actually I'm not certain as to why you don't see that difference. I shouldn't extrapolate on that. I can't really speak to that yet. But our sample, I just want to emphasize, our sample was predominantly, we sampled 2 to 1 women to men to have a large enough sample size to extrapolate. So we can't really speak to the male sample on this study. It's more descriptive.
Okay. So we'll follow up a little bit more on that one specifically with you, Amy. I'm sure that they'd be happy to make some of those results available to you. And I also wanted to highlight, we've gotten a lot of questions about where you can find the materials. So the implementation guide, the games, how-to videos, there's a mini documentary that we sent out to participants ahead of the webinar where you can see the games being played in Nepal. There are also, I think, how-to videos for 5 of the individual games available on the website linked here. And then like we said, all of the implementation manual and the game materials are all available on IRH's website as well, and we'll be sending them out along with the recording from this webinar. So with that in mind, we're going to go ahead and wrap up a little bit early. But if you do have additional questions, please feel free to reach out to us. We're happy to include those in our outreach after and to connect you to any of the presenters, including myself. And then I'm just going to do a little bit more YouthPower business at the end here to talk about how you can stay connected to YouthPower learning. We have resources, events, information, and more on our Learning Hub, which is also where you'll be able to find the recording from this webinar and the links there, as well as all of our resources and partner resources as well. So if you have things you want to contribute to our Learning Hub, please do reach out, and we're happy to identify them. We have a solid positive youth development learning agenda trying to figure out where the field needs to go and where we can fill in gaps, and we're happy to chat with you about that. If you are a young development professional interested in positive youth development, we have our youth platform, Youth Lead, and then there are the 4 communities of practice. So as we've already discussed, there's the gender and positive youth development community of practice. There's also youth and peace and security, youth engagement, and cross-sectoral skills. Feel free to join. I'm sure many of you are already members, which is how you heard about our webinar today. But if you're not, you can join on youthpower.org. And please feel free to reach out to us if you have resources that you'd like on our website, or if you'd like to have a webinar yourself and collaborate with us to promote some of your work. That this is a platform that's designed to be shared, and we are happy to share it. So with that in mind, thanks everyone one more time, and thanks in particular to Nari, Sandra, and Dominic for all of the time and effort that you've put into pulling this together with us, and we're delighted with being able to share this project. I in particular, of course, am delighted with being able to share this project a little bit more widely. And thanks again.
Thank you.